Hey, it's your favorite slightly hood therapist. And today I wanted to come and chat with you guys about ADHD versus generalized anxiety disorder. Let me just first give y'all a little close up. Your girl got her lashes done. I get my lashes done by B Lux, who happens to be my baby sister, but clearly she is bomb here in Memphis, Tennessee at Royal Lashes. Okay, I had to go on and plug her real quick. I will be tagging her in the comments so that you can get your lashes done too. Okay, anywho, so the reason why I wanted to talk to you guys about ADHD versus generalized anxiety disorder. Sometimes I think that a lot of people get misdiagnosed. And so here's the thing about that, right? I remember being a kid when ADHD first became like really, really prevalent. And I was at a friend of my dad's house and just sitting and listening to all these adults talk about, oh, that's a BS diagnosis. They come up with anything. Them kids just need their butt whooped. They can't sit still in class. Okay, we know better now, right? Because it's not just a behavioral issue sometimes with children. Sometimes children are really struggling through things and they can't sit still and focus and concentrate, especially for long periods of time. Some of us as adults can't even do that, but that's neither here nor there. What I wanted to talk about specifically were some of the four main components of symptoms for ADHD and how those symptoms look very similar to anxiety disorder. So basically, anxiety disorder can mimic what ADHD looks like and vice versa. Those four primary symptoms that I'm talking about are the inability to concentrate and focus, your inability to sit still, forgetfulness, and disorganization. Okay, so let's take these one at a time. ADHD, generalized anxiety disorder. If you have issues with anxiety, odds are that it is extremely difficult from time to time for you to concentrate and focus. And that is because not so much so that your brain is wired differently, that the receptors are different, that you have all of these different chemicals that are coming out differently than other people, but because you have racing thoughts. And if your thoughts are racing, what that might feel like is that you have a million thoughts coming at you at one time. But that's not what it is. It's that you have all these thoughts that are coming at you really, really fast in succession, back to back to back to back. And it feels like they're all coming at you at one time. So imagine sitting in a classroom or sitting at work or sitting in front of somebody and trying to have a conversation, and you got all these thoughts going in your head. What's happening at home? What's going on at work? Why didn't I get this finished? When am I going to be able to do that? Is this person going to be mad at me when I see them? All these thoughts, right? Well, if you're here, then you can't be here. And if you can't be here, whatever is being presented to you is not being inputted, it's not being processed. Therefore, you can't retain it. Therefore, you can't regurgitate it. Which brings me to the second point. Forgetfulness. I skipped over inability to sit still. I'm going to come back to that. But it's not that a person has an issue remembering things. It is that they never received the information properly to begin with. It's like I'm sitting in front of you and I can hear you, but I'm not hearing you. I'm not listening because I'm in my head about something else. Therefore, if you come back and ask me what we were talking about, I probably missed half of it. I probably missed a lot of it. And that is what happens when a person has anxiety, which also looks like when a person has ADHD. The inability to sit still. Now, a person with ADHD, there are some chemical things going on that does not allow their brain to calm down enough for them to sit still. When you have generalized anxiety disorder, again, the racing thoughts, the need, the impulse and or the compulsion to keep going, to keep moving, to, I can't get anything. I got to get all these things going and I can't sit still because I can't relax. Your heart rate is up. Your pulse is speeding all the time. You've got muscle tension, which causes you trouble with relaxing. And if anybody knows anything about dealing with anxiety, your sleep is severely disrupted, right? There's a difference in you going and going and going and going and your body crashing, forcing you to get sleep. That's restless sleep. You're not really getting rest versus you putting your body in a state of calm and actually getting the rest that you need. Then, disorganization. So, this is like a coin toss up because sometimes people with anxiety disorder can be very organized. The reason why they can be very organized is because anxiety is largely about hypervigilance, that fear of something that's going to happen and you don't know what that is, but the need to have control because of your fear of not having control and of chaos. And so if I've got, anxiety and I get all these things in order, I'm going to make sure all this stuff happens, there are other things in life that may get missed. And that again brings us back to the racing thoughts because I'm working on a project, right? And then a thought comes to me, oh, I got to go over here and do this. And then as I'm doing this, another thought comes to me, and oh, I got to go over here and do this. And I never finish each of these projects. And I look up and things are just all over the place and I'm disorganized and I'm more overwhelmed than I was before. The reason why I think this is important to know is that I think a lot of people get misdiagnosed. And that is not necessarily all on your provider. It's not the complete total fault of the person that you told, your therapist, your psychiatrist, your psychologist, or whatever. We can only go by what you tell us. There is no machine that we put on your heads that tells us, oh, this is ADHD versus generalized anxiety disorder. We go by what you tell us. And so it's extremely important for you to know what your symptoms are, what they look like to you, and to be able to communicate that to a person so that they can get a better understanding of what it is that you need. I'll cap this off by saying the biggest part of the problem with the misdiagnoses is more along the lines of medication, not so much along the lines of treatment. Medication for ADHD is going to look very different than medication for anxiety disorder. So that is where the issue primarily lies. When it comes to treatment, to be honest, whether or not you have ADHD or anxiety disorder, we can do a couple of different things. We can do behavioral activation. We can work on emotional regulation and distress tolerance. Those are skills that are in DBT, dialectical behavioral therapy. We can do lots of things that focus on treating symptomology and not the diagnoses. So, I hope this was informative. I hope that you are taking good care of yourselves and that you're being insightful and mindful about what's going on with you so that you can seek the help that you need if and when you need it.